Welcome to the Buccal Fat podcast.
No.
Yes, it's it. This is it.
No, this is the Beverly Hills Plastic Surgery Podcast.
No, it's not. We're talking there. Everybody's talking about buccal fat. I'm changing the name of this podcast.
It's officially the Buccal Fat Podcast.
Welcome to the Buccal Fat podcast.
I mean, literally everyone and their grandma is talking about the effing buccal fat. I mean, how many times have you gotten texted or called about that in the past 2 months?
I am blown away that this very, very routine procedure, which I've been doing since I've been a resident, which is like
a really long time.
147 years. I am now hearing about it like it's like, oh my God, did you do that?
Do you do that?
Oh my God, did you do the buccal fat? Did you do that? I'm like, yeah, I've been doing it for quite some time. It's a great procedure.
It's a great procedure. It's been around for a really long time.
Nobody
it's
invented
not novel.
it. Nope. Sorry.
It's a thing. But it's having its moment in the sun because recently several celebrities have come out and spoken, or it has been speculated about them that they had this procedure, and then somehow, as social media does, it turns it into a whole thing, and then it becomes its own thing. And now friends, patients, like news people, everyone's coming and talking about the buccal fat. So
what is it? What is this operation, Dr.
What
Avello?
is it?
What is a buccal fat pad? Where do you find those?
Buccal fat pad is located basically, if you think about it, below your cheekbones, inside your cheek. It's like sort of that area that is rounded in your cheek. And it's a very discreet fat pad. It's why it has its own name, the buccal fat pad. So this is not the superficial fat on your cheek. It's not the fat that you can sort of pinch, when you go, oh, look at the cute little kid. You pinch their cheeks. That's not their buccal fat. That's just a little fat
Never
apple
seen
cheek.
You do that to anybody.
Because I don't. But when auntie comes around and says, oh, look at the cute little kid.
You do have ants.
I do have an ant problem.
You have an ant problem. You got a lot of ants.
I do. But that's not it.
No.
This is an internal fat pad. It lives we access it from inside the mouth. So
literally
it's sort of,
put your tongue in your cheek and that's where it is.
And that's where it is. It's right below your cheekbone, but it's a deep pocket of fat. And some people have a very large buccal fat pad, and some people just have an average sized buccal fat pad.
I've never said that to anybody. I've never been like, I noticed you have some very large buccal fat pads. Although some people come in with some very large buccal fat pads.
You may want to say that.
You do want to say it, but you don't. Because what it is it really makes... So the person who should get their buccal fat out is somebody that has sort of puffy round cheeks, who's young enough with good skin tone to withstand the loss of that volume, because... What causes aging in the face, everybody?
Volume
Loss of
loss.
volume.
Yeah.
Why is everybody pumping fillers into their face? Loss of volume. So buccal fat removal is not for everyone.
And some people, even if they have a very rounded face, it might not be from the buccal fat. So just because you take the buccal fat out doesn't necessarily mean that you're not going to have this super sculpted face, because that's what we're going for. That's the idea. Is that by removing the buccal fat, you can take a sort of round, uncontoured face and give it that contour, those striking cheekbones, the hollows under the cheeks. That's the goal of buccal fat pad removal.
Yeah, and you want to do it as part of a plan. It's very rarely an isolated procedure.
I disagree. I think a lot of people, especially younger people, are coming in for an isolated buccal fat pad removal because they do want to have that contoured look. And it's a fairly simple procedure. You can do it awake. You can do it under local. You don't have to go to sleep for it. And you come in, if you're awake, you get some lidocaine injected into your mouth, similar to when you're at the dentist. And then a very small incision is made on the inner lining of your mouth, inner lining of your cheek. There's a muscle that's right behind there. You just dissect through that muscle, and then there's your buccal fat. Yeah. You tease it out, and that's it.
There's a great video on YouTube of me shucking out a
some
buccal fat
buccal
pad.
fat.
Yeah.
And the buccal
Search
fat,
Dr.
you know,
Calvert buccal fat, and you will
know,
see me get that thing out of there in like 5 minutes. It's so
yeah,
fast.
and then that's it. And then you put some sutures inside the mouth and call it a day. And so the recovery is fairly minimal. You know, the downtime is minimal. You know, maybe several days, a week of soft foods, light foods, and that's sort of it. Pain is very tolerable. So it is a simple, straightforward procedure that can be done. You don't even have to go to sleep for it. So I think that's one of the reasons it's just so very popular, is that you can sort of do it, you know, on an afternoon and go back to work the next day, kind of thing.
Yeah, I mean, I do it under local anesthesia. I've done it in the operating room. I mean, I find it to be, you know, very powerful. But when I was saying that it's not an isolated procedure, I mean, I'm thinking about it as I do with all plastic surgery in the context of how am I going to make this person look better. So it's all about the continuum of like, well, I want more prominent cheekbones, or I want to have a stronger jawline,
Right.
or whatever it is. You want to get. I think there's a. Is you hear like a siren outside?
Are we on Santa Monica Boulevard?
I think we are. I
Is
think it's
it
right out there.
5 p.m.? Yes.
It is, as a matter of fact. So there you have it. I think that may be my ride. I gotta. So anyway, the thing that I'm talking about really is that there is this continuum of like, okay, I want to take the buccal fat out, but what else are we doing to get you
To
that
contour
look
the
that you
face,
want? You
right.
can't. I mean, yeah, you can just take out the buccal fat pads, but you know, I want to make people look better. I don't want to just like do something to them.
Right. No, that's true. So, because usually these patients are coming in asking for a very, you know, specific look. They want to get that contoured look with the striking cheekbones. So you do have to talk about, well, what can we do for the cheekbones? What can we do for the jaw?
Right.
So that you can, like you said, as you mentioned very appropriately, treat the face in its entirety,
Yes.
and not just as an isolated one area thing that we're doing. Some people, that is all they need. But usually you do have to do some other augmentation, subtraction of the face to create that particular look.
Yep, and it's a very effective procedure. The person who should not get this is somebody where removing that volume is going to make their jowls show more, which I've seen it done. I had a I had a coordinator back in the day, and she was like, I want to get my buccal fat done. I was like, I'm not doing it because you're going to need a facelift as soon as I'm finished. And it was just like, it was clear that her face was falling. And she was like, I want my buccal fat out. And I kept saying, no. So what'd she do? Clubbed the guy over the head in the next office and made him do her buccal fat. And the next 6-month period, of course, what's she saying? I need a facelift. I was like, of course you do.
Yep.
Because you took out the thing that was holding
That was
up
supporting
your
your face.
and
right.
so now it's gone. And so, you know, and that's going to be the next thing on this social media deal is like somebody's going to say, I have my buccal fat removed
And now
I
look
look like crap. It makes me look old.
But and that has always been sort of a topic of debate or an argument amongst plastic surgeons is, does the removal of buccal fat, does that create a problem in the future? Or will it cause you to age faster? I don't know. I don't know that that's true. I think if you do the person, like you said, who's a good candidate for it, which usually is a younger patient with tight, good quality skin, they're going to be fine. They're going to get the look they want. And their face will probably age the way it would always age. But in someone who lacks that skin tone at baseline from age or sun damage or whatever, you are going to throw them into that facelift category a little bit faster. But you can do buccal fat with facelifts because you're correcting the problem. So now you're correcting the problem. You're lifting the skin. You're removing some of the extra skin that's too loose, and you're restructuring the deeper layers of the face. So now you can take that buccal fat because you're also fixing the problem.
If they have a big buccal fat pad.
They have a big buccal
and then
fat,
you want to get that out for a volumetric change for sure.
Yeah.
Done it, been there, works. I find that, once again, I know it sounds stupid. It's like we're doctors, but the first thing you need to do when treating a patient is make a diagnosis. I know it sounds totally ridiculous, but people don't do it. They just say, I want my buccal fat out. Okay. Well, think it over, people. Like, really spend some time to like decide, is this a good thing? Is this going to help this patient? Am I making them look better? Am I going to give them jowls? Am I going to remove critical volume that they need? I mean, I've seen a lot of patients where it's a no-brainer. They come in like, I want my buccal fat out. You got it.
Right.
But I've seen others where you really had to think it through because you don't want to do them a disservice. You want to make them look better.
And there are going to be those people that, even though they're young, just aren't going to benefit from the buccal fat. Like, some people just have round, chubbier faces, and it's not because they have buccal fat. It's because that's just how their face is sort of made.
Yeah, I mean, those are sort of the complications, and the complications really are aesthetic. I mean, infections, wound dehiscence, things like that are pretty minimal.
Minimal and minor.
Yeah, I had one person who resumed her duties with her boyfriend too early, and that caused some problems with the wounds.
Don't want to be sticking things in your mouth too soon.
Yeah, I mean, it was like ridiculous.
Protect those incisions.
I mean, she came in with severe pain and these 2 open wounds, and I was like, what happened to my sutures? What's going on here? And she tells me the story. I'm like, did that seem like a good idea to you? Like, was that really the right way to go? But,
yeah,
sometimes, as I always say, when you got to go, you got to go.
Yeah, but soft diet, people, soft.
Oh, man. I'm not going to touch that one. Anyway, so yes, you want to take care of it. Obviously, soft diet, rinse with mouthwash 50-50 and peroxide if you want, or you don't need Paradex and all that stuff. I mean, I don't use that. I know that
these are small incisions.
Yeah,
they usually heal great.
I don't put people on antibiotics for this.
No, you don't need any of that. Yeah. And the results that you'll see, of course, like with all surgeries, you're going to be swollen, for the first couple weeks. But you'll start to see the results come in. You'll start to see some of that contouring, 4 weeks, 5 weeks, 6 weeks.
What you do on the weekends when you go on Saturday too.
I do. I have patients that come in and I am about contouring, but I do have patients that say, I want that contouring, doctor. And I'm like, I got you.
Sure. No problem. We can give you some contouring. Well, yeah, I think that's it. I mean, I don't know what happened that this became the social media craze of the day.
But we're piling on it. We're adding to it.
We're into it. We want to explain it for our listeners so that you know what to do. I've been doing this procedure since I was a 8-year-old. I mean, it's really straightforward. I'm telling you, my video is really good. It's it's like I walk through it, I explain it. I'm like, here's where it is. You just go, spread the fibers of the buccinator, and like, boom, it's right there. And then this thing shucks out like you're taking a...
And when it comes out like that, it's so satisfying.
Good.
Yeah.
It's so
Sometimes
satisfying.
you have to work at it a little bit, and that's not as fun. But when they just like pop out, it's like, oh.
Yeah, it wants to be released. It's like a horse running out of the barn.
Right. Yeah.
It's a good thing. So there you have it. Buccal fat pads. We're all about it. It's all the rage, and we're in.
Yep. The effing buccal fat.
And with that, this is the Beverly Hills Plastic Surgery Podcast coming to you from the 9021 Buccal Fat. 90210.